Hello friends and professionals. I am Dr. Indranil Chatterjee. I am in charge and head of the department Audiology and Speech Language Pathology, Ali Yawarjang National Institute of Speech and Hearing Disabilities, Regional Center, Kolkata. I am teaching and guiding students of masters and bachelors in audiology and speech language pathology since last 20 years. And I feel during my teaching and research work, the speech gear is having enormous opportunities to grow and to provide so much clinical infrastructure with reference to improving swallow skills, and also in a greater extent this tool provides different techniques to improve childhood apraxia of speech and also neurological acquired oral apraxias in patients with neurological impairment. Now I am giving you some flashes, like this is a technique, this is an instrument, this is not a technique, this is an instrument tool which is named as sucking tube. This tube I feel very much useful to develop suckling lip reflex in pediatric children with cerebral palsy, management of cyalorrhea like drooling. So if you keep on increasing the length from slick to the bigger one, the width, the diameter of the tube is more, it will provide you much more pressure, like it will develop different type of viscous forces or surface tensions across different fluids. So you can shorten this in this way. Gradually you can develop this with reference to this. Even you can, in between you can use this for the cleaning. This is a very interesting devices. I have felt very much very much useful for all SLPs working in the clinic with reference to dysphagia, not only pediatric dysphagia but also dysphagia in adults having some neurological disorders, from stroke to the patients having palliative care, even in cancer patient, neurogenic dysphagia as well as oncological dysphagia. This is basically the tool called speech gear. I have very much strong impetus that it will provide you strong help, like this, all these equipments, like the V-Pen. It will provide the vibrations as well as non-vibrations. Like if you put this with this particular instrument called TTUD here, so you can use this with vibrations. See, this is the vibrations. I feel these vibrations, but when you put here, there is no vibration. So when it is vibrating, it's a bigger stimulus. When it is non-vibrating, it is a very softer stimulus. So in this way you can develop different aspects of the oral movements. That is called oral placement activities and oral kinematics, oral kinetics, and also it will improve oral sensory perception. It is a purely a device which can be used by SLPs in a greater extent, and it is an indigenous Indian product. Like this, it is a tongue, this equipment, the full box, it is available. It is tongue depressors. You see, this box are available. There's a lot of equipments with that. And if here there is a staggered portions, the portions are with a scratch, portion is smooth, this is not as a rough. When the staggered or rough surface, if you use with this, it will provide you different perception, and here it is providing you different perception. Like it is actually felicitate you with reference to the motor learning principles. I use this type of instrument of V-Pen with like these devices. This devices is actually it is an important devices. It is called as Unitip, which there are different surfaces this one surface, this is one surface, this is one surface, and different and smooth also. So if I use this, if I put this in this way, and if I do this, somebody is doing like, you have to grip with a pen, like you use without vibrations, with vibrations, but I use it differently. In the next some sessions, if it will provide I will provide you some different instrumentations activities using chiropractic manipulations or chiropractic assessment or chiropractic management with the oral musculature. That is a very new one. I am standardizing it. Namaste.